Hello and welcome to the English News Bulletin of Hallabol. This is Rashmi here with you. Before moving to the details, let us have a look at the day's headlines. CT scan machine of city's prime GB hospital remains dysfunctional for long days. Escalating COVID cases every single day leaves the citizen in huge terror. %21% COVID-19 positivity rate recorded in Tripura's capital city. Congress chief Sonia Gandhi raised her deadly attack once again on the Modi-led central government, said they want to silence the nation. Now the news in details. State Health Ministry is in slumber under the Tripura Health Minister Biplab Kumar Deb. Every day, patients are dealing with some or other problem at state's prime referral hospital, GB. This time, GB hospital CT scan machine remains dysfunctional for long days. Amid the ongoing chaos in the city's prime referral hospital GB, that is also considered as the biggest state government hospital in Tripura, problems are a never-ending story. Every day, patients are visiting the hospital dealing with some or other problem. Saturday, a new problem has been recorded from the GB hospital for which the patients are suffering to a great extent. When already kidney patients were suffering due to shortage of dialysis equipment, now the CT scan machine remained dysfunctional, which has hit a major part of the patients. Talking to the media, a patient party said, "I'm bound to take back my patient home, signing a bond at my own risk without completing CT scan procedure, as we don't have financial capacity for private CT scan tests." The helpless patient party added that from last 6 days he has been roaming in the GB hospital, but the authorities sent him back, saying that the CT scan machine is not working. After trying to do it from a private healthcare center, the authorities demanded 14,000 rupees, which is a big amount for the poor people like him to bear. He said the same, adding that, "I am a poor man, a daily worker."
আমি আজকে আজকে 9 দিন চলে, মানে 9 দিন ভর্তি আছে।
কি অসুবিধা আপনার?
পেটের সমস্যা, লিভারের সমস্যা।
তো এখানে আইছেন পরে কি কইছে? সিটি স্ক্যান করাতে হবে।
সিটি স্ক্যান করাতে হইব। আমি
কতদিন যাবত আপনার জিবির এই সিটি স্ক্যানের এতে ঘুরতাছেন?
আমি তো 6 দিন ধরে ঘুরতাছি।
6 দিন ধরে এখনো সিটি স্ক্যান
নাই, এখনো গিয়েছি। এখন মহারাষ্ট্রে গেছি, লালকেলা গেছি, তো লালকেলা তো হয় না।
এখানে গেছেন
জিবিতে গেছি, জিবিটা নষ্ট। ডাক্তারবাবুরে কইছি, ডাক্তারবাবু কইছে আপনারা বাইরে করান, আপনারা লিখিত দিয়ে বাইরে যান, বনসই দিয়ে যান, গিয়ে আপনার সিটি স্ক্যান করে সিটি স্ক্যান দেখাইলে পরে আমরা রিপোর্ট দেখবো ভালো না খারাপ। যদি ভালো হইলে আপনার সারা দিমু, খারাপ হলে তো আমরা ভর্তি লেখুন, কথাটা বুঝে নিব। আর আমরা রুমের লোক ডেলি করোনা রোগী মারা যেতেছে, গতকালকেও মারা গেছে, পরশুদিনও মারা গেছে। আমরা ওই মেডিসিনের দ্বিতীয় তলার আছি।
The patient was admitted at the GB hospital from Kamalpur's Halahali with stomach problems, but due to the non-functional condition of the CT scan section, the patient party could not complete the treatment. Every day, news reports from various electronic and print media repeatedly tried to aware the Health Department of Tripura under CM Biplab Kumar Deb about the this situation at the state government-run hospitals. But the Chief Minister seems to be acting as if he is in a sleeping mode, as no work has been done in this regard to restore the health services in the state. Bureau Report, Hallabol. COVID cases escalating every single day leaves the citizens in huge terror. Media Bulletin as on Friday revealed 93 COVID deaths in Tripura. It is a matter of grave concern that COVID-19 is increasing at an alarming rate, where shaky healthcare system is adding salt to the wounds, leading to higher mortality rates. It is clearly visible that India as well as Tripura is facing a challenge with respect to the disease, where active cases and death toll are escalating each day, and the worrying aspect of this is that the positivity rate is continuously increasing, which demonstrates that the disease is circulating intensely. According to the media bulletin, till date in Tripura, active cases are 3,284 and recovered are 7,037 as on Friday. Total number of sample collected is 2,62,409 and sample collected on 28th of August is 1,135. Number of positive patients in Tripura are 10,417. Number of death as on Friday, 28th August is 93. Bureau Report, Halabol. Here we are going to connect with Dr. Pritam Chatterjee, Neurointervention and Endovascular Intervention, Apollo Hospital, Chennai. Welcome to Halabol, sir.
Yeah, good evening. Good evening to the viewers of Halabol and the citizens and residents of Tripura. Thank you for having me in the show.
We are deeply elated to have you with us.
Thank you. Same here.
At first, we would like to know from you, would you kindly please detail what is coronavirus or COVID?
The coronavirus is an infection which is caused mainly by respiratory route when somebody coughs or sneezes and the other person is in front of you or near you and the infection spreads like that. So it is caused by a virus from the coronavirus family, and COVID is the disease. The coronavirus disease is actually the COVID. So when a person gets symptoms and the disease related to coronavirus, it is called as the COVID.
If anyone is found positive to the COVID tests, what should he or she do to save the risk of death?
So first of all, very, very important, whenever somebody gets diagnosed with COVID, they have to remember that it is an infection which, is a very new infection, but people should not get worried about it and don't need to worry about death. First of all, most patients who get COVID infection will come out and will not have much of side effects like, going to ICU or, having death. So they should first have no fear of death. So first of all, they have to see how the symptoms are. Whenever a person is diagnosed to have a COVID infection or COVID disease, so we actually classify them as mild, moderate or severe category.
Okay, sir.
So patients who are having mild disease and moderate disease, usually they don't have to worry. And severe disease will definitely need admission and ICU attention. But my personal suggestions to all the patients is that they don't have to worry when they get COVID disease. Most patients with COVID will come out without any harm to the body.
Okay, sir. So now if the results of the test conducted comes out negative, what precautions should one follow to get rid of being affected with the virus?
So, see, even if the result is positive or negative, if you have symptoms which are suggestive of COVID, like you have high fever or you have sore throat, cough, and having breathlessness, it is very, very important that you isolate yourself in a particular room and ensure that people who are around you, like your family members, everyone should be isolated. They should not come in contact with you. And most importantly, the patient and the family people or whoever coming to the family in contact, they have to wear mask. They have to maintain social distance. Mask is very, very effective in preventing the disease from spreading to people.
Okay, sir. So how can we manage stress and emotions at the situations when somebody is positive to the virus or negative, but in terror of being infected someday or the other? Everyone is living in a terror nowadays, sir, for getting infected. So what should we do to avoid the mental stress in this time?
Yes. So I would request everyone, so whether it is COVID positive or negative, if you are having COVID, not COVID, first of all, you have to take care of your health. Everyone has to take care of their health by doing some normal activities every day. You have to exercise.
Please says few activities that one should do.
Yeah, you have to do some few activities like every day. Try to keep yourself fit, do exercise, do meditation, do some breathing exercise. Like you can follow some yogic, yoga you should do at home. You should try to have at least a basic jogging. If you're not able to go outside, at least in your house, try to walk around inside in the house, in the room, so that you are fit enough, and your mental fitness is very, very important. So you have to do some kind of relaxation activities. You can watch the movies.
Any
you can watch
particular food items that should be taken in this time?
So food, I think what you should do is you should try to keep your immunity, better. For that, you should try to have food which is rich in vitamin C. Try to have as much as fruits as possible. Try to have oranges in your food. You can add lemon. So this will definitely keep you fit. And also try to have a balanced diet, having lot of salad and fruits in your diet, which is will actually help you improve your immunity. So try to.
Sir, my last and final question to you. Sir, as you yourself is a frontline warrior in this crucial time, what tips would you give to help the caregivers and other doctors and medical staffs in this time?
Yeah, it's a very, very important question you asked. I think I would like to congratulate and wish all of them that they are doing a very wonderful job, and with the support of government, everyone is trying to save many and many patients every day. So what my suggestion is that everyone try to help the patients as much as possible. So COVID warriors are the real warriors now. So they are the real frontline workers. Your help and your support will really help a lot of our Indian citizens and citizens of all the states come out of this dreaded disease. So try to help as much as possible, and you also have to take care of your health. The COVID warriors also have to take care of your health. You have to take care of your nutrition and try to help as much as possible our citizens of the country.
Thank you, sir. Thank you very much for your valuable time. Thank you for joining us. 21% COVID-19 positivity rate recorded in Tripura's capital city. As per the latest government data, the COVID-19 positivity rate is high in 9 wards of Agartala Municipal Council. As per the latest government data, the COVID-19 positivity rate is high in 9 wards of Agartala Municipal Corporation. The state of Tripura has recorded a total of 10,436 COVID-19 positive cases, of whom 7,037 have recovered. Total of 94 COVID-19 patients have lost their lives so far. National media reported Tripura's capital city Agartala to be worsening in the case of COVID-19 situation, as the positivity rate has been found at 21% compared to the state level positivity rate that stands at 3.86%. As per the latest government data, the COVID-19 positivity rate is high in 9 wards of Agartala Municipal Corporation. The COVID-19 positivity rate was 92% in ward number 4, followed by 52% in ward number 6, 94% in ward number 12, 99% in ward number 20, 93% in ward number 26, 32% in ward number 32, 100% in ward number 40 and 69% in ward number 46. Expressing concern over the rise in COVID-19 cases, Chief Minister Tripura Biplab Kumar Deb said that violation of maintaining social distance and other norms by the residents of the capital city have been noticed, and this has become one of the prime reasons for the hike in the positive cases. Also, in the past 7 days, the state level positivity rate was 3.86%, whereas in the 9 wards of Agartala Municipal Corporation, the rate was 21%. The current situation is very risky, and therefore Chief Minister Biplab Kumar Deb requested everyone to maintain social distance and stay at their homes except for necessary works. Chief Minister Biplab Kumar Deb further added that the government has taken required measures for COVID-19 patients and to prevent the chain of transmission. He said the same in a video message that was circulated in the media. Chief Minister Biplab Kumar Deb also added that as per precautionary measures, the state would include extra 110 beds with ICU, OT and ventilators in the state-run Govind Ballabh Pant Hospital, the first dedicated COVID hospital in the state. Besides, the state government laid stress on conducting more COVID-19 tests. Bureau Report, Halabol. Congress chief Sonia Gandhi raised her deadly attack once again on the Modi-led central government, said they want to silence the nation, adding that the ancestors who sacrificed their lives for the sake of the freedom would have never thought the same in their wildest dreams. Congress President Sonia Gandhi attacked the BJP government in the centre, said that they want to silence the nation. Though Sonia Gandhi did not name Prime Minister Narendra Modi or his administration, the Congress chief raised her ante against the central government with deadly attack. She added, influence of dictatorship on the country is rising. Divisive forces are spreading hatred through the India. Freedom of expression is at stake and the country is in a crisis that none of its founding fathers would have imagined. Sonia Gandhi said it while speaking via video link at the groundbreaking ceremony of Chhattisgarh legislature. Sonia Gandhi further added that power that want people to fight are spreading poison of hate in the country. None of the ancestors, including Mahatma Gandhi, Jawaharlal Nehru, B.R. Ambedkar, would have imagined that India will be facing such a tough situation even after 75 years of independence.
इन्हीं मंदिरों से हमारे संविधान की रक्षा होती है, लेकिन याद रखना होगा कि हमारा संविधान भवनों से नहीं, भावनाओं से बचेगा। इन भवनों से दूषित और गलत भावनाओं के प्रवेश को रोकना होगा, तभी हमारा संविधान बचेगा। हमने पिछले 7 दशकों में एक बड़ी दूरी तय की, कई चुनौतियों का सफलतापूर्वक सामना किया है और कई बड़ी समस्याओं से छुटकारा पाया है, लेकिन हम अपने पूर्वजों के सपनों से सब अभी भी बहुत दूर हैं। आज़ादी की लड़ाई के दौरान जो प्रण हमने किया था उसे पूरा कर।
Sonia Gandhi also took up the issues like the centre not clearing its dues to the state governments and holding entrance examinations at a time when India has been reporting highest number of new COVID cases in the world. Bureau Report, Halabol. 74 Battalion BSF launched a hybrid and multi-pronged operation on 2 different target locations and smashed huge illegal cultivation of cannabis and seized 22 cattle from different target areas. 74 Battalion BSF along with Shunamura Police and Forest Protection Unit of Bokshannagar Range on Saturday smashed illegal cannabis plantation and destroyed ganja plantation in an area over 22 hectare in Forest Range of Manikkanagar and Uttar Kalamchhara in Shunamura subdivision of Shipaijola district. The joint operation party, maintaining social distancing protocols of COVID-19, destroyed premature cannabis sapling. In other simultaneous operation based on the reliable info regarding gathering of huge herd of cattle in 2 houses near IBBF in village Putia block Bokshannagar ward number 5 and 6, a joint operation with PS Kalamchhara was meticulously planned and tactfully executed by the troops of 74 Battalion BSF under the supervision and direction of Sanjay Kumar DC. The operation culminated with huge seizure of 22 cattle having estimated value of rupees 2.6 lakh. FIR in this case has been lodged by the police against 2 identified persons of village Putia under Cruelty Against Animal Act. During the operations party observed the illegal cultivation of cannabis plants on forest land. The operation party smashed 2,500 cannabis saplings from the field. Bureau Report, Halabol. Well, that's all from the English desk at this moment. For more news and updates, stay tuned to Halabol.